Nurses play a crucial role in addressing and raising awareness about the risks of vaping among adolescents. Adopting a strengths-based approach is key to effectively engaging with communities. By partnering with schools, parents, and caregivers, nurses can establish trust and work collaboratively on addressing vaping concerns. In educational settings, nurses can foster open and non-judgmental conversations to explore why adolescents vape and correct common misconceptions. Understanding motivators such as peer pressure and social media influences helps tailor education to meet adolescents' needs and raise awareness. Building rapport with students and using evidence-based resources like statistics and lived experience testimonials offer alternative perspectives. Encouraging student questions during sessions enhances learning and leads to more effective education strategies. Collaborating with teachers to promote positive social norms can significantly reduce vaping rates, as students are less likely to start if they believe their peers don't vape. Nurses can equip parents with clear evidence-based information about vaping dangers, empowering them to discuss these issues with their children. Including parents in school initiatives such as workshops ensures consistent messaging at school and at home. This comprehensive approach addresses vaping from the classroom to the community, promoting long-term health and awareness. Risk assessments are essential functions nurses perform to identify and mitigate health risks related to adolescent vaping. By conducting comprehensive needs assessments, nurses gain insights into the social challenges and adolescent issues, informing targeted interventions. Physical and psychosocial aspects of vaping are evaluated, including vital signs, lung auscultations, and mental state examinations, to assess health impacts like nicotine addiction and respiratory issues. Nurses use tools to determine the level of risk from low to high by asking questions about the frequency, duration, and patterns of vaping, as well as peer influences and e-cigarette access. Nurses can assess the severity of the habit. They evaluate physical symptoms and potential negative consequences such as withdrawal effects. Using the transtheoretical model, nurses assess readiness to quit and nicotine dependence. Nurses consider the broader social risk factors such as family dynamics and whether caregivers also vape or smoke, which can influence adolescent behavior. Geographical and economic barriers that might limit access to support are also evaluated. This data helps guide personalized interventions that actively address vaping risks and promote healthier behaviors among youth. Vaping is a persistent issue requiring ongoing attention, not just a one-time intervention. Schools, nurses can pursue a holistic approach by keeping parents and caregivers informed, as they play a key role in influencing adolescent health. It is important that for nurses to regularly coordinate education for both staff and parents, especially in primary and middle schools, where vaping experimentation often begins. This ensures adolescents receive support both at school and at home. Many caregivers may not fully understand the risks of vaping or recognize signs that their children are using e-cigarettes. Nurses address this gap by providing clear evidence-based information on the dangers of vaping, such as nicotine addiction, respiratory issues, and its impact on brain development. By simplifying complex medical terms, nurses empower caregivers with practical advice on having open and non-confrontational conversations with their children. Nurses also provide resources such as community support programs, cessation tools, and sites like Quick Victoria to help caregivers monitor behaviors and maintain vape-free homes. Involving caregivers in workshops and meetings ensures that messages about the dangers of vaping are consistent at home and in the community. This collaborative approach strengthens community health efforts and empowers caregivers to support their healthier choices. Nurses play a key role in promoting community capacity and by collaborating with multidisciplinary teams to address adolescent vaping. They work with doctors, social workers, school staff, and public health officials to develop comprehensive evidence-based prevention and intervention strategies, acting as a bridge between healthcare and education. Nurses help integrate health concerns into school policies, or organize awareness campaigns, and participate in community initiatives like workshops on vaping risks. The Victorian School Nursing Program exemplifies this approach, using the school entrant health questionnaire to assess health, advise parents, and make referrals when needed. The questionnaire functions as a clinical tool and informs broader policies and practices. Nurses follow up with families and agencies to ensure referrals are effective, tailoring interventions to meet ongoing needs. Additionally, nurses support doctors in prescribing and administering medications while educating families on proper usage. Nurses collaborate with social workers and psychologists to provide emotional support. This teamwork improves care quality, reduces medical errors, and fosters a safety culture, leading to better health outcomes. By addressing social determinants of health and reducing health disparities, nurses promote healthier choices in the community, particularly by working to reduce adolescent vaping. Nurses can incorporate resources like the Ottawa Charter to enhance their role, which provides a comprehensive framework for promoting health. Nurses can use this guide to guide their roles in disease prevention, health promotion, and community engagement. One recommendation is to expand routine school health screenings, such as those in the Victorian school nursing program, to include more comprehensive assessments focused on vaping. This proactive approach enables nurses to identify and address vaping-related risks early and offer targeted interventions that promote healthier behaviours and reduce vaping amongst adolescents. This aligns with the Ottawa Charter's call for reorienting health services and policies towards prevention and health promotion. Collaborating with multidisciplinary teams ensures that tailored interventions address social determinants of health, such as socioeconomic status and access to healthcare, which is crucial for reducing the prevalence of vaping among adolescents. Engaging with diverse backgrounds to develop culturally responsive care skills is key to enhancing nurses' roles. Recognizing cultural diversity and avoiding assumptions is crucial for improving health outcomes in multicultural communities. Nurses should apply interventions that resonate with adolescents from different backgrounds. This aligns with the Ottawa Charter's emphasis on creating supportive environments and enabling individuals to make healthier choices. Nurses can advocate for health-centered school policies, promoting evidence-based practices like screening, brief intervention, and referral to treatment over punitive measures, and fostering a supportive educational environment. Challenges like geographical and socioeconomic barriers can be mitigated through family engagement and providing accessible health resources, thus advancing health equity. Nurses can support families by providing written health information and offering telehealth consultations or in-person meetings. Nurses can strengthen community action by collaborating with public health authorities and school administrators to help establish public policies that regulate e-cigarette sales and marketing. Their advocacy efforts align with the Ottawa Charter's focus on empowering communities and ensuring coordinated and comprehensive approach to reducing adolescent vaping and promoting long-term health outcomes. Thank you for listening.